Have you ever wondered how spinal decompression therapy actually works? Is it just another therapy, or is there some real science behind it? Today I'm going to break down exactly what is happening inside of your spine during this therapy and why it can become a go-to option for a lot of people dealing with chronic back pain, specifically things like disc bulges and disc herniations. I'm Dr. Garst with the Well Chiropractic Clinic here in Mesa and Gilbert, Arizona. Now, before we dive into this therapy, I want you to quickly understand the spine itself, okay? The spine is made up of vertebrae, these little bones that are stacked on top of each other. Now, there's these soft little discs or squishy material between them. These act like cushions. They're shock absorbers. They're going to allow your body to move and be lubricated over time. Now, due to aging, degeneration, daily usage, injuries, these discs can become compressed. And when that happens, we may get things like a bulge or a herniation, which can put pressure on that nearby nerve. That's when you're going to start to get the symptoms. Things like pain, muscle spasms, numbness, tingling, immobility. Those can all occur when we put pressure on that nerve. So what is spinal decompression therapy? It's a non-surgical treatment that is designed to relieve, like I said earlier, the pressure on the spine, specifically the nerve, by taking pressure off that disc. Decompression typically involves a special table that gently stretches in the spine in a controlled movement, typically in cycles, with the goal of creating space between the vertebrae. Now, here's where it gets really interesting. The real science lies in what happens during that stretching process of your spine. So first, we're going to talk about an idea or concept called negative pressure. So when the spine is gently pulled apart, something called negative intradiscal pressure, that's a big word, is created. Now, in simple terms, what that means is you're going to get a little bit of a vacuum effect inside of those spinal discs. This can help pull the bulge or the herniated disc material back into a better position and reduce the pressure on the nerve. What also is happening is it's going to encourage the flow of water, oxygen, nutrients, blood flow back into those discs. So think of it kind of like rehydrating a sponge. It's going to help the disc regain some of its natural height, function, and positionally structure. Another key benefit from decompression is when you take the pressure off the nerve, it can reduce the pain that might radiate to other parts of the body. Think like you've heard of sciatica before. If you relieve that pressure, spinal decompression may reduce some of the inflammation around that disc and nerve and allow those affected nerves to recover at a higher rate than if it didn't. At the same time, you're going to get improved circulation in that area. It's going to support the body's natural healing processes, which is awesome. Now, the research is really clear. Clinical studies have shown that spinal decompression therapy can have massive effects for certain conditions. So the main ones being herniated discs, bulging discs, degenerative disc disease, sciatica, chronic lower back pain, but it's not a one-size-fits-all solution. The results can vary depending upon the individual, the severity of pain, how long somebody has been dealing with this condition, etc. So a natural question we get on our office a lot is it safe? And the answer is for the most people, yes. For the most part, yes. It's considered very safe when performed in a controlled environment by a professional that's made a certain recommendation based on the injury you have. Now, it's not always suitable for everyone. So things like fractures, advanced osteoporosis, other certain spinal conditions we could talk about, but it's not always proper for those. But that's why a proper evaluation is essential before starting decompression treatment. So, is spinal decompression therapy backed by science? Absolutely, but effectiveness comes down to a lot of things. Biomechanics, pressure changes within the discs, the body's ability to heal even when given the right conditions. So if you've been dealing with chronic back pain, if you've been dealing with the disc herniation, the disc bulge, it might be worth exploring decompression as a natural way to get some relief if done in the appropriate circumstance. So if you found this video helpful, let us know. Don't forget to like and subscribe. Check out our YouTube for other videos on spinal health and pain relief. But if you need help with decompression, we offer that in our office, and that's something we would love to be able to help you with. So comment back pain below if you've had a disc injury, and we'll get informed with you and get back with you as soon as we can. Talk to you guys soon.